This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
The question is whether it's winter or summer. I mean,
No.
what is it?
Listen,
what is it?
I think it's fall, John,
Okay.
definitely.
Okay. Good morning and welcome to another edition of Health Watch. Every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. And I'm your host, John DeMasi. Together, we're going to try to get you healthy for the next hour with some good information about what Innovative Medical Associates does, how they do it, why they do it, when they do it. All of those questions will be answered. And if you have questions or a medical challenge to run by Dr. Molly, feel free to call in at 855-839-1210, 855-839-1210. At any time during the course of the show, feel free to call in with a question or a medical challenge for Dr. Molly, 855-839-1210. And as always, Dr. Molly will start off with, what do you actually do?
What do we do? Well, John, I don't know, but we did it for 6.5 days this week.
Yes.
So, yeah. Anyway, we're a group of like-minded healthcare professionals who actually believe in doing anything that we can to help reduce the need for medication for our patients. And by that I mean we don't tell you throw your medication away. We are a primary care facility that all of us work out of the facility in Marlton, New Jersey. And when I say reduce your need for medication, what I'm saying is we can do, if you need to have an antibiotic, our docs can prescribe it. If you need blood pressure medication refill, my docs can prescribe it. But the real key here is using God's ingredients or natural products to help augment that so that we can reduce the side effects that may come about from the medications themselves.
So in other words, you basically have the same procedure as other primary care, but with an added bonus.
Correct. And that's really the direction that we've all wanted to go in because of what really has been happening. All these new drugs that are out in every category, every problem, new drugs, lots of injectables, lots of biologics, lots of new molecular structure drugs. We realize that there's so many side effects. Lots of our patients come in and they're complaining about their condition. They don't realize that the condition has been exacerbated by some of the drugs. So when we really started, we realized this can be a potential problem. So how do we eliminate this? Well, we're pretty educated in natural substances, vitamins, minerals, amino acids, things that you may well get in a health food store. But again, the problem is if you go into the health food store, the clerk, whether they're knowledgeable or not knowledgeable, they may not give you the best advice. They may send you to an aisle and say, hey, pick one from column A, one from column B. Actually, that's really not good enough. What we found that hydration, medical hydration therapy, has been the best way to deliver these natural substances, particularly for people with chronic conditions.
And those chronic conditions may be?
They may be as complex as some cancer conditions, autoimmune conditions, and also as simple as things like rashes, this kind of thing. But also people who have hypertension. We have worked with cardiovascular diseases. You talk about it, our docs have worked with it.
You have over 600 and some protocols.
Variations, yes.
So the likelihood that you have something to deal with some problem is very great.
Sure. And again, because we are a primary care facility, we can draw the blood right there, send it out to local labs. By that I mean conventional labs, LabCorp, Quest, whatever, MDL, you name it, we can send it to it. As well as because of our non-conventional status, we have a whole series of non-conventional testing that we can send to. For example, we can do an analysis on your complete nutritional status. That's a big deal. And it can help us say, hey, this is the problem. The reason why he can't lose weight or he's feeling fatigued may be as simple as vitamin Bs. So again, we are lucky enough to be in total that we're able to bring in conventional testing and integrative testing. And this is the beauty of working with like-minded professionals.
What are some of the ingredients or some of the items that you put into the bags?
Very simple things like vitamin Bs, but in certain forms, right? We don't necessarily. Some people have a genetic propensity that they can't metabolize certain B vitamins. So again, I'm looking at the blood work, talking to the doc and saying, I believe that this patient has a dysregulation on the gene pool, so we need to look at Bs in this area. Also can use vitamin C, one of your favorites, and our extracts are so unique that we're able to reduce some of the vitamin C side effects that people are worried about. This week, we're going to talk a little bit about some of the things that people have brought up to my attention and how we can dispel the myths of some of this stuff for vitamin C. So, again, we can use amino acids. The ability to have all of these things compounded with our compounding pharmacist is so important. He's a member of our team, even though he's physically not in the office, because the substances we use, I like to use just extracted from natural ingredients.
Compounding pharmacy means what?
They can make up all kinds of vitamins for us from the sources that I want to get, as long as they're FDA, quote-unquote, approved. And let me tell you, folks, the FDA is running havoc with us and havoc with your health. It's something you should be talking to your congresspeople about. And you know I'm a member of the Alliance for Natural Health, and I'm urging all of our listeners to go on there and start looking what they want to limit. Just another alert came out about bioidentical hormones. The hormones that God gave us, they don't want the pharmacist to compound. Ridiculous, right? Yeah. But it's out there, and we have to be conscious of the FDA and, acknowledge the good that they do, but they also are stringent in their requirements.
This is a question that comes up just about every consultation. Does this natural products, does it work?
Yeah. Part of the issue is when you go into the health food store and you go and get some vitamins, you're not really sure of the dosing. And remember, where does it have to go? Through your digestive tract. How much of the particular constituent that does the work works? If you lose 30 to 50% of it in your gut, therein lies the rub. That's why hydration, medical hydration in particular, really works.
Because it goes right into the bloodstream.
Absolutely, and it will affect the tissues or the organs or the system we want to correct.
Back to your protocols. So you have some 600 plus.
Yes.
So the likelihood that you have something for a condition is high.
Sure, but here's the other rub, John. I have many of these protocols are all written down. I mean, I have a book of recipes, so to speak. But the interesting thing is, it's the ability to interchange these sometimes for a particular patient. You're not on the same protocol that you were on, 2 years ago, because we have to take into consideration some other issues that you've had. So again, the thing is, these protocols in our facility are very fluid. They're going to work for an individual patient.
And I can always tell when you change protocols.
Oh, I know you can. I know you can. And most of my patients can. And
yes.
That's the beauty of it. The idea is we want to address your immediate problem, but we also want to address your long-term health concerns. That's a pretty interesting roller coaster. So we really need to look at the patient in his or her entirety. And that, I believe, separates us from a lot of other primary care.
On average, and I know this is a hard question, on average, how long do people have to go till they can see results?
You know, you and I talk about this week in, week out, and I tell you, I still get the question. So you're right. I don't know, but I have seen results in as little as 5 weeks. And certainly my patients are apt to tell you that they've seen results in as little as 5 weeks. But it can go on to 30 treatments. It could be as much as 40 treatments. I mean, obviously, if you come in with stage 4 cancer, you're not going to be in a state of homeostasis in 5 weeks. It just can't happen. So the earlier you get in, the more likely that we can effectuate changes in terms of your quality of life more quickly. And that really is the key also to our facility. We're looking at the patient's quality of life, regardless of where they are in whatever types of challenges they have and their condition. We want to hear from you. What is it that really resonates with you, and how do we improve your quality of life as opposed to the neighbor in the next chair?
We are coming up on our first break of the morning. This is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. And we always tell you this is a good time for you to call in if you have a question or a medical challenge, because we can have plenty of time to answer your question. 855-839-1210. That's 855-839-1210. Again, it's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly and I will return with more of today's Health Watch after these words. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates. They thought they were going to get the day off because the Phillies won. But no, that doesn't happen. 856-489-0505. 856-489-0505 is the number. You call, you make that appointment for the initial consultation with Dr. Molly. It is complimentary, doesn't cost you anything, and you will find out a lot about your condition and about how Dr. Molly can help you. 856-489-0505 is the number, and the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. It is Health Watch right here on Talk Radio 1210 WPHT every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. We're going to go to the phones and talk to one of our favorite callers, Frank in the Frank in the Northeast. Frank, good morning. Welcome to Health Watch.
How you doing, Frank?
Good morning, Dr. Molly. I heard John say, call early. Call early. Says, I got to call first.
Good. Hey, listen, Frank, it's funny because you're on my third eye today. You know, Barbara has been working on a list of nutraceuticals for you. We have been so busy with the out-of-town folks. We had like 4 for the last 2 weeks each week, so it's been a little hectic, but we actually were in the office yesterday and started to work on this a little bit, so expect the
Dr.
calls.
Molly, well, that wasn't one of my topics.
But I just want to apologize. So,
No, hold on. Barbara called me yesterday.
See? Yeah, because she and I worked on this. Good. God bless you.
Well, I was going to thank Barbara, the great listening audience. Dr. Molly's IMA, the people care about you. They were kind of closed yesterday, but Barbara and Dr. Molly worked on something and gave me a call. They're always working. Excuse me, allergies are killing me today.
Yeah, all of us.
But Dr. Molly, something popped my mind last night. Oh, before I forget, I want to issue a challenge to your great audience out there. I want 2 first-time callers. 2 first-time callers. You've been listening for a long time. Pick up the phone. Call Dr. Molly on the radio. Dr. Molly, I've known you for a long time. You are more humble than humble pie. And you don't pat yourself on the back. This popped my mind last night. When most people, most of them, when they come to see you, they tried everything else. So they're pretty bad when they come to see you. You're not starting, they're healthy already. Your success rate of turning people's lives around is greater than any hospital, any doctor's office.
No,
I mean,
Frank, you're embarrassing me, actually, Frank. No, I can't say that. Come on.
I know you
Conventional.
can't. That's why I'm saying it for you.
God bless you. God bless you. God bless you, Frank.
Seriously, your numbers are probably 90 to 100%. A hospital anywhere from 0 on average to 40%. Once in a while they get all high numbers, but on average 0 to 40%. You're like 90 to 100, and we come to you on death's door pretty much. Okay, you know what I'm saying?
Yeah, we try. We really, really try, and we really do care. It's evident. It's evident. It's evident through all
thanks a
my
lot for the
people.
call, Barb. Yes, I appreciate it.
Oh, good. I will. Because when I left. We had spent I guess about 40 minutes on this after finally getting our Indiana patients off and running. We actually worked 6 days this week, 6.5 if you count a couple of nights. So it was that kind of day, and I did want to. I said, let's see if we can wrap this up and get the information to Frank. And I'm really glad that she was able to do that. We had spent most time on it. So I hope it helps, Frank. I really do. And
Well, I'm going to call them today or maybe in the morning. They're busy or open, But, like I said, first-time callers, 2 first-time callers today. Let John get the phone number, 855-839-1210.
He's doing my job for me. This is
John,
great.
I'm going to have to use him.
That's right.
Maybe when you're on vacation, I might have to use Frank as the co-host. Okay? That'd be great.
Oh, Dr. Molly, one more. I don't think I ever told you this. Whenever I get better, I believe I will, there's 3 things I want to do. I want to be a cop again, I want to be a nurse again, and I want to volunteer at your place a couple times a month because you're awesome. I've never been around anyone like you in my life.
Oh, God bless you. And we would welcome you to do that, Frank.
I would love to be
God
there.
bless you.
Thanks, Dr. Molly.
Frank, thanks for the call.
Nice call.
And
call.
Thanks for the mini host.
Yeah, he's a good man. Anyway, Frank. Okay, so John, one of the things this past week, and it also took up a little time, was one of my patients from Indiana said, you really are hyping hydration, medical hydration. But what about us who have kidney challenges? So now I'm sending this over to you,
right?
Because you have a story to tell.
Yes. Let's see. It's now 13 years.
That's right.
13 years.
I checked back on the medical files.
That's right.
That's right.
And I had a kidney removed.
That is right.
Because it was cancerous.
So you have one kidney.
Right.
Right.
And you always said to me, we've got to protect the one kidney.
Exactly.
Because if that goes, you're on dialysis.
Correct.
And you don't want to do that.
No.
So, 13 years of, functioning kidney.
Right. And
good, thanks to hydration.
And good kidney function.
Yes.
And here's the thing. Having, kidney function and kidney disease and kidney failure are 3 different things. So, you really had a problem that day. I was with you in the emergency room when we were trying to get you into a very well-known surgeon. And we finally did it, but it was many hours later. But from that point on, though, I believe that medical hydration actually helped you. One of the things I explained to this gentleman was, listen, having a history of chronic diseases like diabetes, anemia, high blood pressure, heart disease, or heart failure actually affect the blood flow to the kidneys and do what? Contribute to inflammation. So one of the things I'm very fussy about through any and all of our hydration protocols is running the kidney numbers. We look at BUN, creatinine, proteins on an ongoing basis when a patient is with us, so that we're trying to prevent any kidney damage from moving on. And you're not the only patient I have, but you happen to be my host, so you can talk without violating HIPAA,
right?
Who has kidney problems and has had a history of cancer that affected their kidney. So I look at this now from a global perspective. And when a patient comes in and says to me, oh, but our kidney, my doctor said it can ruin my kidneys. Well, I started to look at the kidney failure and kidney disease conventional treatments. And, obviously the medical history, you want to run the same type of testing that we do, including ultrasounds, that kind of thing. But really, what is interesting is according to the stages of the condition, They actually prevent this by utilizing hydration, because dehydration contributes to worsening the disease. So again, I started to look at some of the substances we use in our medical hydration, magnesium being one of them. That helps prevent the kidney stones, because again, I've heard nothing but the old wives' tales that, vitamin C is going to contribute to kidney stones. Well, I don't necessarily believe that given all of the things, but I know that is a conventional thing that's out there, okay? Again, I think it really depends, and I understand. I have a very good friend, and everybody knows her, Dr. Carr from out in Oregon, and I speak routinely, and she's doing a paper on just that subject that probably will be published in PubMed in the next 6 months, and I'm looking forward to reading that, about kidney stones and relationship to vitamin C. Also, B6, very, very important. It can reduce calcium oxalate levels, thereby reducing calcium oxalate stones. Vitamin E is beneficial for lowering calcium oxalate levels. Also, using extracts from certain berries help reduce calcium stones. And one of my favorite things is aloe vera. You know, I use that extensively for digestive issues. So again, there are many, many non-conventional treatments that can help. But if you need dialysis, you need dialysis. I am not telling anybody to stop going to the nephrologist. I'm not saying that. I'm saying, why don't you come in earlier before you actually have a liver failure and look at how we can help you protect your kidneys. And again, if you go back to the underlying comorbidities, you see that they're all inflammation related, and all what? They're stopping the blood flow to the kidneys, so the kidneys can't filter out some of the toxins and some of the other things that have to go through the kidneys, and without the right fluid balance, it won't work. So we really have to look at dehydration, making sure we look at the shifting electrolyte levels, and really concentrate on helping a patient through this, not harming the kidneys, and we are very particular about that. I have wonderful physicians who really monitor carefully.
Where did it come from that hydration is not necessarily good for the kidneys?
I think it's an old wives' tale, really, and I think it's all about fluid retention. And again, the fluid retention really goes back to the imbalance of the electrolytes, especially in the lower extremities. So what happens is there are ways to balance that out. And if you see in our clinic, you'll see various sizes of bags. That also helps, because we may not use the same amount of fluid for each individual patient, but we certainly are going to try to hydrate them. So, John, all I can say is when you have dehydration, you suffer from a lot of other issues, including cognitive issues, which are extremely important. And people think they're going out of their minds. I would like everybody to reassure everybody that most people who do medical hydration are very, very cognizant of the kidney issues. And I thank my patient who came in from Indiana, whose physician told him he's making a big mistake. He's going back to see that physician, and he said, I have never felt better after a week with you guys.
And that will put us at the halfway point of the program. Health Watch is the show, Sundays 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is the number here in the studio. 855-839-1210. You want to take Frank up on the challenge of a new caller here on the show? Feel free. And you got plenty of time to call, 855-839-1210. I'm your host, John DeMasi. Dr. Molly is here. Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We will both return. More of today's Health Watch after these words. We are back here on Health Watch, and again, operators standing by right now at Innovative Medical Associates. And you can reach them at 856-489-0505. That's 856-489-0505. When you call, all you really need to do is schedule the initial consultation with Dr. Molly. It is complimentary. It doesn't cost you anything, and you will learn a lot about what Dr. Molly can do for you as far as her protocols and your condition is concerned. So give them a call, 856-489-0505. And if you want to check out more information, the website is fabulous, really. It's updated frequently. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. And our show is Health Watch every Sunday, 8 till 9, right here on Talk Radio 1210 WPHT. Our phone lines are open, 855-839-1210, 855-839-1210. You have encountered a multitude of problems in your career, Dr. Molly.
Yes.
And one of them is chronic infection.
That's right.
And this is really a serious
chronic
problem.
infection is very serious, John. You know, one of the things I said is, you know, we are what we eat. So what's eating us? There's the question.
Yes.
And chronic infections, viral infections in particular, and viral bacterial infections, pathogens of every kind. This came up again this week because I have a patient who's presently in treatment and, you know, her quality of life has improved, but she still has fatigue. So she goes to her regular family doctor, and he said, there's no way that you have, quote unquote, an active infection. And she said, yes, but the doc at Dr. Molly showed me my lab. And he said, oh, it's probably not a certified laboratory. It actually was. It was LabCorp. And it was an interesting thing. He said, if you had that, you'd probably be dead by now. But no, what I want people to think about is conventional medicine focuses on the infection's acute attack or the first phase. How do we treat that conventionally? Well, Dr. Molly does not tell you don't get a vaccine. That's one of the ways we treat it. Don't fill your prescription if it's an antiviral or, you know, for hepatitis C. If you have hepatitis C, you fill the prescription. If you have HSV, herpes, those kinds of things, you fill your prescription in antiviral or the antibiotic. So, you know, that's fine. But it's these low-grade persistence that comes about after the initial bacteria or pathogen is wiped out that I'm concerned with. So it's the residual from that. For example, the body still may be making antibodies towards that. Therefore, there may still be somewhat of the infection left, and they causes complications from all of these things. And some of the common conditions that I'm talking about are Lyme disease, that tick-borne illness, Epstein-Barr, which also can be attributed, which is another viral. We can look at chronic fatigue, fibromyalgia, and what do they all have in common? Inflammation that has been non-resolved. So they resolve the chronic condition, but they don't resolve the ongoing inflammation from the subacute, or what's the leftover, as I like to say, of the challenge. So when you look at that, what are some of the symptoms? John, you know them. You hear it every week in our clinic. Fatigue, joint muscle pain, headache, sleep issues, brain fog, neuropathy, mood and depression, etc. These are just some of the conditions that people are left with after they treat the original condition. And you would think that some of the conventional wisdom would have changed after COVID-19, right? Because we are living with post-COVID syndrome. And what do you think that is? It's a viral condition. So we know that there are residual effects from this. And so when patients come into our clinic, what is our approach? Well, we have to do the medical review. We have to uncover what chronic condition started this, right? And remember that chronic infections take time and some digging. That's why I always talk about the archaeology that's involved in trying to find out what kind of chronic condition the patient has post the acute.
So you're looking at underlying conditions.
That's right.
And conventional medicine may not be looking at that.
They're looking at the acute infection. This is what we did with COVID. We knew we put out the antiviral for the COVID, didn't we?
Yes.
But what are we doing for the post-COVID? That's the connection I want people to see. And that is true for many pathogens, not just COVID-19. It hit us hard. Meaning as a group, it hit us hard. And it's really showing its ugly head with the post-COVID. And we, of course, have a post-COVID protocol. But what I'm saying is you have to look at all of these conditions just the way we look at the post-COVID. So I say to people, don't you think conventional medicine should be moving in the direction of what integrative or functional medicine has been doing for years? We look beyond the acute infection. We want to help people who are suffering from that list of symptomatology I spoke about that was affecting what? Their quality of life.
And, that's really the crux of what you do.
Exactly. Exactly.
Because you're looking at underlying conditions, and conventional medicine just solves the problem for the moment.
That's right. And what I'm saying is when this patient went into her primary care doctor, he did her a disservice by putting in her mind that she couldn't have it, otherwise she'd be on death's doorstep. No, what she's having in terms of her quality of life is horrible. She might as well be on death's doorstep. And the way that we approach this, again, is the medical review, the medical archaeology. We look for integrative laboratory panels, and I don't mean using non-accredited laboratories. I'm talking about things that we can send out to LabCorp, to Quest, to conventional labs. And we look for what? The host of the underlying infections that have been left from the original infection. That's the key, John. Then we look at what prescription meds they may need to go back on. Maybe we use a subclinical dose of some of those so that they don't have the side effects. And what else do? We attack it with medical hydration therapy, which includes the supplementation that we talk about, things to build up your own immune system to ward off future pathogens. Very important. And what do we use for that? We have protocols for that. We have a protocol for Epstein-Barr. We have a protocol for Epstein-Barr and chronic fatigue, fibromyalgia. Come on, let's talk about them. What do we use? Well, we may use glutathione. We may use a blend of nutrients like vitamin C, but particular extracts of vitamin C that especially are definitely in lower measurement in the patient's system because what? Of our standard lifestyles. We might want to look at your metabolic issues. So we may look at amino acids for you. We're using subclinical doses of things and repurposed medications in subclinical doses to help with this. So again, what we look at is, okay, what else can improve oxygenation to your immune system? So we go way beyond people who come to me and say, well, I'm going to, such and such a spa and I'm getting a Myers cocktail. That's great. Myers cocktails are great. I'm glad you're doing. It can fight off some things, but you know what? It's not enough when you have many of these chronic underlying infections.
So bottom line here, if you have a chronic viral condition,
yes.
How should you approach this?
Again, you need to go to a place that's going to look at digging out what caused the condition initially, looking at laboratory results that can be used within the framework of a protocol, looking at nutraceuticals or natural substances that may help you with this and give you back some quality of life, because most of these people are really quality of life driven. They've been run over from these parasitic infections and these pathogens, and they can't function in the real world. And we're all about your functionality. So, we have to really look at what kind of things can help them in terms of the natural substances, and then bring in repurposed drugs that might have been used for some other condition that may help them in a therapeutic level that will work along with the nutraceuticals.
Until I met you many years ago, I never heard of any of this stuff.
I know. I know.
If people are in this quandary of a condition and they're suffering, how can they approach this logically? I mean, with someone like yourself.
Well, you want to come in for the free consult, and we can talk about what's going on and what's the history of why you're feeling like this. I had somebody who told me they couldn't no response to the prescription medication that their conventional physician put them on for a particular viral infection. So we started chatting it around, docs and I, the MD docs and the DO docs. We started chatting about this, and we put the patient on colloidal silver in addition. Now, people out there, all my listeners know about colloidal silver. Well, yeah, it helped him. So, what you have to do is, again, I'm going to go back to the patient. The patient must be proactive. Just because somebody tells you there's nothing else you can do, no matter what that condition is, you know what I say? There's always another bus. I was a city kid. If you didn't catch this bus, you walked 2 blocks up and you went around, but you got there.
That's right. We are coming up on our final break of the morning, which means you still have plenty of time to call in with a question or a comment. 855-839-1210 is the number, 855-839-1210. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. And I'm your host, John DeMasi. We are both coming back with more of today's Health Watch after these words. We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates. The number 856-489-0505. Again, that's 856-489-0505. You can call now, or you can call after 9 o'clock because, they work all day, okay? So, just because we go home, that doesn't mean they do. 856-489-0505. Check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show, or if you want to hear it again, it's our Health Watch replay this afternoon, 4 to 5, right here on Talk Radio 1210 WPHT. We are going to the phones right now. We're going to talk to Anthony in Belmar. Anthony, good morning. Welcome to Health Watch. You're on with Dr. Molly.
Hi, Anthony.
Hi, Dr. Molly. Hi, John. First of all, I love the show. Good morning. I listen every Sunday. Awesome. So my question is, I heard you talking about the creatinine level in the kidneys, and just by chance, I had a blood test, and the doctor said it came back a little bit high.
Okay.
So he just told me to, drink some water, don't take no aspirin. But here's the first thing I want to tell you. I'm like a very medically aware person of my health. I'm disciplined, right on top of it. So I actually got like 2 questions for you. What exactly does that mean? And second of all, I have a question about inflammation. And I know it's going to sound funny, but they say I have inflammation. What is it? Like physically, like what is it?
I can tell you, inflammation. Okay, inflammation. Let's start with the inflammation. Inflammation is a condition where the body is. If you've ever cut your hand, right, or cut your finger, you notice that your body gets red, meaning in the area. It's where the cells have all gone there and have done the job and started the healing. Inflammation is a process that can be good. But when it gets out of control, that's when we have problems. Interesting that he told you have inflammation and your creatinine is high. I bet you anything that the inflammation that you have might be one that's vascular in nature. Do you have any other kinds of problems, Anthony? Just give me a heads up.
Well, actually, I don't know if it's a problem, but I was actually diagnosed maybe 2 years ago with having some small plaque deposits.
Yes.
And
good. Yeah,
and what happened is that I went to my cardiologist, And besides him wanting to give me a statin and take the 80 milligram aspirin, he really believes in supplements.
Good for him.
So I take a lot of supplements, and it's under control, and I don't have no blockages or anything, and I'm very active. Do the treadmill 3-4 days a week. But you see what you said about the inflammation? I understand what it is, but the thing I don't understand is when the doctor says you have inflammation, okay, where can I find it?
You may find it vascularly. The plaquing was a good indication of it, right? Listen, it's blood flow, head to toe, right? I'm telling you, I think I know who your cardiologist is, too, and he's pretty smart, but you have to wait a long time for him, right? So in his office.
Oh my God, yeah. Sometimes my visits are like 8 hours, literally.
I know. Listen, I know. And I actually know that he does believe in this. And one of the things, because he sent me patients, so I do know that. And let me tell you, Anthony, one of the things you're doing right is the supplements, the antioxidants. What's happening is free radicals are getting created, and that slows down the blood flow. You need more oxygenation, and you're doing all of that through the supplements. You ought to come over to our office. I'd enjoy talking to you. You're a smart boy.
Okay, I'm sorry, John. Yeah, but, I mean, so as far as the creatinine, he wants me to take another test. But, I mean, what exactly is that? Like, are my kidneys going bad?
No, not if it's slightly elevated. You could have been dehydrated that day, especially with the weather we were having. That's why I say hydration is very important. A little bit, the electrolytes can go out and cause some of these problems. But creatinine is actually a substance. It should be excreted through the kidneys because the kidneys are filtering it out of the blood. But what can happen is you can have an overabundance. It gets sometimes caught a little bit in the filtration mechanism of the kidney, but it's nothing to worry about if it's only slightly. People who have inflammation can have that. Just continue to drink a lot. Keep an eye on your electrolytes, which I know you're doing. If you're going to the doctor, I think you are. God bless you.
Well, here's another thing.
Go ahead.
Does omeprazole have anything to do with it?
Yeah, yes, it does.
Because I've been taking that for a while.
Why don't
for acid and stuff. So
listen to me. Cut that down.
What?
Maybe not take the full tablet. Go to a half and add George's Aloe. I just plugged something I shouldn't do on the radio. But
what is that? George's Aloe? What is that?
Yeah, George's Aloe. It's aloe juice. It's clear. It's triple filtered. It's one of the things I use extensively in the office. Okay.
Anthony,
God bless you.
Good luck with that.
Take care,
Thank you so
Anthony.
much.
Thanks for the call. Thanks for the call. We have Jane in South Philadelphia. Jane, good morning. Welcome to Health Watch.
Hi, Dr. Molly. I got a couple of general questions.
Sure.
Oh, so how do you test if you're deficient in minerals, amino acids, and if you have parasites? How do you test for them three things?
Okay, so it's easy for doing the amino acids and the nutrients. As I said earlier in the show, there are many integrative laboratories that we use in our facility. We use two in particular because I know the mechanism of the testing. So we can get an actual readout on your entire nutritional evaluation. So again, it's usually not covered totally by insurance, but it's well worth the money because it can really help you. You can do individual vitamins, etc., from LabCorp request. That can get done, okay? But it's much more difficult that way. For the parasitic, conventionally they did stool testing, but you can also look for things like the viruses, the antibodies that the body is producing to certain viral conditions, and pick that up. So there are a couple of ways to do this. Does that make sense, hon?
Yeah. Now, like if you have your insurance don't cover, roughly, how much money you might have to pay out?
I'm not really sure. I'm not really sure that, but if you call the office, Joanne will tell you, because I really try to stay out of the money as much as I can because I got a soft heart, honey. So I want to help people. That's my job. Okay?
And
Jane,
what might be my next question, if I could?
Sure.
On the commercial, they talk about thyroid eye disease. What is that?
Oh, thyroid eye disease is it's really an autoimmune disease, and it affects the thyroid. That affects our eyesight. It's making overabundance of antibodies bad, so it's not a good thing, hon. Please.
Thanks for the call, Jane.
Thank you, Jane.
Appreciate
You're
it.
a nice lady. God bless.
One more call quickly. Carl in Vineland. Carl,
Hi,
good
Carl.
morning. Welcome.
Hi, Carl.
Hi, how you doing?
Good.
I've listened to you for a couple of years, and I want to kick myself in the ass for not calling you 2 years ago.
Come on.
But I'm glad that I've listened, so I'm interested. Real quick, I've just I got type 2 diabetes. I've had ulcers on the bottom of my feet. And other things for it's my quality of life kind of sucks.
Yes.
Right now I'm in a rehab place because I got 2 grafts put on these things for the second time.
Oh my goodness.
And this whole year has been spent kind of hanging in these rehabs and stuff. And, the doctor treats the infection or whatever and makes it, but I'm interested in this underlying type of stuff that could be there. I mean, I've been dealing with this foot issue stuff for the last, 4 or 5 years.
Sure. How long have you had
it's really been
the diabetes?
The type 2 diabetes.
Yeah.
I guess they diagnosed it back in 2016.
Oh boy.
That type
How old
of thing.
are you?
But
how old are you? Sir?
I just turned 62.
Oh
but
my
boy,
God.
I don't feel 62.
I know.
feel like I'm
You're
40.
a baby. You are a baby.
I look young too. So, but I want to meet
that's
you.
good.
So you can tell me how old I really look.
Okay,
But
I would
anyway,
like
but
to
who
do
cares
that.
about that? I just
No,
I want
you
to come
wanna
in for that initial consult.
Please.
And I got
please.
2 friends that I want to definitely bring them in.
Please.
Because they're they need you.
I would love to talk to you about those foot ulcers too, but we got to wrap it up.
Right.
But I really
know you
would.
do. I know.
All right. God bless you, my friend.
Yeah, Carl, what you do is, in fact, I'd call right now if I were you. And
Well, he's in the rehab, so
as soon as you can call and get to a phone, call and make that appointment with Dr. Molly for the initial consultation and your friends.
And
Sounds like you need it.
I definitely can help him with this. I think my doc and we can really go after those foot ulcers. The other thing is, with the diabetes, he's got global inflammation. That's what's happening.
That's right. And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators standing by, and they'll be there well after we leave you at 9 o'clock. So you can call this morning, you can call this afternoon, but call 856-489-0505. That's the number, 856-489-0505. And check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget our Health Watch replay this afternoon from 4 until 5. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Vicky, and Daniel. And then, of course, there's wonderful Joanne, fabulous Fran, delightful Dee, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening. We'll talk to you next Sunday, Health Watch, 8 till 9, right here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.